Welcome to another episode of Public Health Uncoded podcast with Dr. Saroj Pachauri, brought to you by Center for Human Progress in partnership with the POP movement, where POP stands for Protect Our Planet. In this podcast series, where we have dwelled into the most pressing health issues of our time in the past, unraveling the complexities of public health with experts from around the globe, today's topic specifically has leveled up my curiosity and interest to very carefully listen to the conversation. Navigating the WASH, climate change, and primary healthcare. Ooh. Water, hygiene, and sanitation are interconnected and is addressed as WASH. We all know that. Although it has been recognized as a human right by the United Nations in 2010, that goal is far from being achieved. Billions of people around the world do not have safely managed drinking water services, they do not have safely managed sanitation services, and in fact they lack basic hand washing facilities. But how does climate change affects water cycle, or how is climate change anyways related to wash? And even if it does, then how does it affect human health, and who are the ones who are most affected? All these questions are there in my mind now. And so I do not want to wait anymore and just invite our today's expert guest, Dr. Debadutta Parija. Dr. Parija is the country lead for tuberculosis, infectious diseases, and surveillance at Nishtha, Jipaigo, India. He holds an MBBS and an MBA in health system. With over 20 years of experience in national health programs, Dr. Parija has worked with the government, WHO, Jipaigo, and many other organizations. His expertise includes health system strengthening, TB control, and family planning. He has extensive experience in donor engagement, grant proposal writing, and managing large projects. Dr. Parija has contributed to national TB guidelines and published extensively in international peer-reviewed journals. Welcome, sir. And now, I request Dr. Saroj Pachauri to please take on the conversation. Welcome, ma'am.
Welcome. Welcome, Dr. Parija. It's so very good of you to join this discussion this morning. I am honored that you have agreed to lead this discussion on navigating the intersection of water, climate, and primary health care. This is a very important area of work, an area that is cutting edge, in fact, an area that we need to talk about and learn about. And your inputs, your experiences, your insights would be extremely valuable for us in this discussion today. Let me say that traditionally and continuously, unfortunately, we have been treating all these areas of work in silos. We do primary health care, we do water, we do sanitation work, etc. But all this is in silos. Now, obviously, it makes sense to look at the intersections between these and provide integrated healthcare. This is something that we have been fighting for many, many years. And to some extent, we have succeeded. But in this particular case, we have a lot of work to do. So may I request you to please tell us why you think this is important and what measures can we take to address this issue?
Okay, thank you, Dr. Pachauri, for having me on this podcast with you. It's a real honor to be on this one. So yeah, I, as you rightly said, water and climate and primary healthcare have been treated as silos, especially by health. But then we need to understand that they are not isolated issues, and they're, interconnected in myriad complex ways, right? And water is not just a resource. It's a very fundamental determinant of health, which influences everything, right? From health to sanitation to hygiene to food security to even disease transmission. So, and climate change again, it exacerbates the challenges related to water, right? whatever the existing water-related challenges are there, I mean, climate change only makes it worse. It introduces new health risks. It introduces from the extreme weather events that we have been seeing increasingly. It changes the pattern of vector-borne diseases that we have been seeing. We are seeing a lot of new things happening among even disease transmission and basic entomology. So understanding these connections is crucial for addressing some of the most pressing global health challenges that we face today. While access to clean water and sanitation, I mean, it's a basic human right, right? I mean, it's something that is taken for granted in most of the developed world, and it's the cornerstone of public health. It all starts from having access to safe, clean drinking water. Yet, as we know, millions still lack access to this very basic safe drinking water and sanitation facilities, right? And unfortunately, the changes that happen because of climate change and the way it affects health uh, affects the marginalized and the vulnerable disproportionately. I mean, they are the ones who are affected way worse than the slightly affluent or the well-off population that we see. So that is where the primary healthcare infrastructure, especially in countries like India, they need to play a very crucial role to bring together all of these, the impact of climate change on human health, the impact of water, awareness around this. A lot of those things need to come together and converge at a primary healthcare level, so that the community gets access to a lot of these services right at their doorstep at the community level, right? So that's why understanding these intersection and treating them as one whole problem rather than in silos is crucial. Over.
Thank you, sir. This is very helpful. You know, as you were speaking, I began to think back on the earlier work that we all did on trying to integrate services. In the beginning, just health and family planning services, and subsequently sexual and reproductive health services. And you would recall that it was a huge battle. Many of us had to play, to fight, to advocate for. Strong advocacy efforts were needed. It took years, but ultimately we did succeed. And now we have an to that extent, an integrated service program. And there again, I think that may have some lessons to offer in terms of what we are trying to do today in terms of water and sanitation. And you're absolutely right, sir, in that climate change is causing a serious health crisis. And therefore, we cannot ignore the linkages between climate change and health. In fact, we are writing books on this because there's very little research done on this area. And your inputs would be very valued if you would be willing to join. So let me ask you, how should we go about doing this? The big task is, how can we empower communities so that they demand these services and make the service system accountable to them? And then how can we bring about this integration between these various services? And you are right, the fulcrum has to be the primary healthcare system.
True. And it's a very, very pertinent and very valid question, because till the community gets empowered enough to demand, in a way, demand solutions to their problems and hold the health system accountable, things will always be business as usual, right? I mean, health system does things, and then honestly, there is no accountability, and it's largely because of issues around awareness as well. I mean, the community itself doesn't really know the extent of the impact of climate change, for example, the extent of the impact of not having access to clean drinking water, for example, right? The extent of impact of let's say we have been focused on, let's say, fecal contamination of drinking water, but are we really talking about, let's say, heavy metal contamination, lead contamination, arsenic contamination, right? The health system itself, especially in developing countries, they are itself waking up to the threats around heavy metal contamination and the impact on women and children especially, right? So community is still quite some distance from understanding these issues. So unless we empower these communities, unless they themselves understand the threats that is posed uh, and honestly, especially in countries like India, big countries, right? Every state or every even district has its own very own context specific issues. The hills of the northeastern states of India, the challenges there around climate change would be very different from, let's say, Tamil Nadu, right? I mean, it's very context specific, and we have to make sure that the community understands their own needs first, their own challenges, and the health system has to be secure enough to let community ask questions, hold them accountable. And so that is where we should have the first step. For example, we have something called as Jan Arogya Samiti in India. I mean, we are supporting them. So this is basically elected representatives at the village level, or the panchayat as they call it, who are who are quite influential in their own villages and in their own communities. So now we are setting up these Jan Arogya Samiti, or the community wellness committees. We are empowering them, training them, giving them checklists, and making sure that health becomes a mandatory part of their monthly meetings or their weekly meetings. We are beginning to sensitize them around the impact of climate change. So in a way, this movement has started where the community representatives are beginning to ask pertinent questions to the health department. And once that happens, that would really set the ball rolling towards the direction of making sure that the primary health care systems that we have, as you rightly said, it was an uphill struggle establishing these, and now that we are in some kind of a shape to deliver services, this is where the community needs to come in, hold the systems accountable, demand services, and not only services, but also look at the quality of services at these primary healthcare services, right? So all of this needs to converge at the community level in order to be really effective and really do what they're supposed to do. So does that answer your question, or would you?
Yes, very helpful, sir. Very helpful indeed. I think the whole issue of empowering communities through ground level activities, through the panchayats, etc., is in India, for example, is essential, and I'm really happy that work is underway in making that happen. I think that once there is an empowerment at the ground level among the community, then the demand will come. And once there's a demand, services will have to be provided. It's traditionally it's been the other way around.
True.
Traditionally it's been passive. The health system says, here, these are services, here they are for you, but the community is very passive and just maybe does not even actually take the services, or go for the services. But it should be, that equation should be reversed, as you rightly
Absolutely.
pointed out. And there should be a demand, and not only a demand but an accountability. In other words, the health system itself, which has always been all powerful, has to respect the community and its needs and respond to those needs
Very true.
effectively.
Very true.
So, yes, I think we'll have to turn the table around, actually, completely upside down from what it has been in the past, so that the health system becomes accountable to the clients, to the people that it is trying to serve. Now, that is a fundamental, that's a very fundamental point, which has to happen before we can talk in terms of convergence of services.
True.
But we are continually adding services. Earlier we were dealing with family planning services. Then we added sexual reproductive health services. Then we were dealing with non-communicable diseases, and we now are faced with communicable diseases. And so, there's a heavy, it's quite a heavy load, if I may say so, on the health system itself. And now we are talking about other issues like water and sanitation and so on. So those of us who are in public health programs like you and I, uh, we need to think about how we can make sure that the system is strengthened so that we are able to provide all these various services and integrate them. And as you said very rightly, not just provide the services, but provide quality services. The word quality is absolutely important because unless we provide services that are of quality, they will not be used.
Absolutely, very correct.
So what do you think?
Yeah, I mean, absolutely. There is no doubts about that has to be the way to go forward. I'll give you the example that we are doing in India, right? So India, I think a few years back, it's a fairly new concept. We were traditionally restricted to the sub centers and the PHCs, as you must be aware. But then through the Ayushman Bharat mission, we now have something known as the health and wellness centers, which are also called as Ayushman Arogya Mandirs. So these are the last mile health posts, which cater to a population of, let's say, 5,000 to 7,000 people in the community, and these are manned by a position by a new cadre of staff known as the community health officer. Now, this community health officer is somewhere between a doctor and an auxiliary nurse midwife. So these are trained graduate nurses who then have been given a bridge course and then through a competitive selection process posted to these health and wellness centers. And they are now mandated to deliver a bare minimum of 12 services, which include, I mean, you would be surprised, this package of 12 services includes stuff like mental health, eye, ENT, right? I mean, basic emergency services, injuries, in addition to the traditional, as you mentioned, family planning and NCDs and communicable diseases and all. And now these health and wellness centers are mandated to have 14 essential diagnostics available, at least 120 odd essential drugs available. And remember, these are at the last mile and the community level, 5,000 population, right? So these tests include the basic tests like the hemoglobin, the height, weight, BMIs, the blood pressure, the temperature, the oxygen saturation, the basic HIV screening. So a lot of these tests are now mandatorily available at these health and wellness centers, right? But again, as you rightly said, having services is one thing, but making sure that these services reach the people as their simple example. I have done a lot of work in TB. I mean, that's my primary focus area. So something as basic as a sputum examination, right? I mean, if I'm coughing, why should I have to travel all the way to a district hospital or a community health center just to get my sputum tested? Now, this is where these health and wellness centers come in. They are the ones who are now screening the communities for signs and symptoms of TB, collecting sputum, getting them tested. And this leads to a lot of prevention of out-of-pocket expenditure, right? People had to travel, they had to spend a lot of money, basic on travel, on tests, on drugs. So now that the services are available at their doorstep at the community level, literally, a lot of out-of-pocket expenditure is I mean, the reduction is there. Dramatic reductions are happening in out-of-pocket expenditure. The turnaround times, I mean, people used to wait till the cough really got bad and then they would go, right? I mean, the delays in diagnosis were happening just because of lack of access. So now we have access because now these centers are right there at the community. This is just an example. I mean, we are also working towards, let's say, something called, we are the official partner of the Government of India Climate Change Human Health Division, where we are working on something known as greening of health facilities, which basically means developing green and climate resilient facilities which have solarization, complete solarization that depend purely on solar energy, complete rainwater harvesting, replacement of all traditional bulbs with LED, effluent treatment plants, biomedical waste. Say a lot of these are happening right from the sub-centers, health and wellness centers to the highest tertiary care hospitals, right? So now this climate change, making low carbon emission health facilities available, that thing has already started even in health. And trust me, convincing doctors, public health specialists about the impact of climate change on health has been uphill. I mean, doctors are used to diseases, right? I mean, you give them a disease, they will treat. But convincing them that climate change does play a major role in a lot of these things. But then, yes, this has started and this is going on. So, yeah, that's it.
This is very, very important information, sir, that you have provided. The fact that we are going to the last mile, making services accessible to the poorest of the poor, who otherwise are not going to be able to get either the services for diagnosis or for treatment or for prevention. And this is indeed a major milestone. And I would like to congratulate you for having done this,
Thank you, ma'am.
and for sharing this information. What I feel is very important is also to document these experiences. We need to, if you don't tell me, I may not know. And even if I know, there are many others who need to know. So if there is so much good work going on in terms of greening the facilities, and in terms of providing access, in terms of reaching the last mile, and so on, a lot of work indeed, and very good work. I think it needs to be documented. And that is very important because that's the only way we're going to be able to share widely the lessons that have been learned from this experience. There's one other thing that you mentioned, and I'd like you to say a few words about it, if you would, please, is mental health. We are now realizing that probably the biggest problem that we are going to face is mental health. And this is an area that has been shrouded in silence for a very long time. The problem has been there, it's increasing, it's getting much worse. And all these factors related to climate change are making it even worse. And it is today probably one of the most important challenges that we need to face, but which is yet to be even fully acknowledged. What do you think?
Absolutely. I mean, I couldn't have put it better. I mean, this is what we are seeing unfold right in front of our eyes. So what's happening is that the challenges with mental health is the issues around mental health also disproportionately affect the vulnerable, the women, the children, right? And more so in countries like India and other developing countries, the biggest challenge is mental health is not considered as a disease, right? I mean, it is. If I'm diabetic, I will have no shame going to a doctor and talking to the doctor about my blood sugar. But if I am depressed, or if my family members see that I'm clearly in need of medical health around mental health, the stigma that comes in, right? I mean, that is the biggest battle we need to fight. I mean, the stigma around seeking care for mental health is massive. I mean, it is worse than even infectious diseases like leprosy had at some point, right? So the first step that we need to overcome is addressing the stigma around mental health, making communities aware that mental health issues are basically health issues, right? I mean, it is nothing that can't be addressed or can't be treated. So number one is addressing those issues around mental health, around stigma. Number two is getting people to talk about it. I mean, the woman of the house, she will come to a sub center or a hospital to seek care for her pregnancy related issues or other conditions. But A, she doesn't talk about mental health issues, and B, the service provider, that is the community health officer or the medical doctor at a PHC, is also not doesn't have mental health in his radar. I mean, he or she doesn't even screen for mental health, or doesn't even know how to talk to patients around mental health. So the awareness generation, awareness in the communities has to be supplemented by working on the capacity of the health systems to address those as well, right? So to talk to understand the sensitivities around mental health, and to understand that these patients need to be dealt with extreme care, and keeping the sensitivities in mind. So it's a double pronged problem. I mean, there is a problem around awareness, there is a problem around the service provision for this. So it needs to be worked on, and mental health is cross cutting, right? I mean, as I coming back to the, because I have worked a lot in TB again, So we have seen patients, multi-drug resistant TB patients who have to take medicines for 2 years, right? Daily, toxic medicines, side effects. Their major issues that they have is, one of them is obviously mental health. I mean, they are losing weight, they are having adverse drug reactions, they are stigmatized, but then nobody understands that. People think you have TB, here are your drugs, get well. But it is not how it works. I mean, unless you address the issues around mental health, you will see a lot of people stopping treatment midway, giving up, right? I mean, those only add to poor outcomes and complexities. So yes, I agree. In short, we need to talk about mental health and address those issues.
Yes, this is an area that has been covered with silence. Nobody talks about it, neither the service providers nor the service receivers.
True.
Neither the patients nor the doctors are even conscious of them, or consciously talk about it.
Yes.
But unfortunately, it is on the rise. And it is probably going to continue to, I'm sure it is going to continue to increase as we go along the way, because we know that the whole issue of climate change is impacting directly and indirectly, is affecting mental health. And this is a huge growing problem, which, as you rightly said, is not being looked at all. And that it needs to, therefore, we need to start from scratch, actually, to begin even breaking the silence around it, if you would, you know. And I think there's need for a lot of orientation of the medical profession itself. The medical profession itself has to be oriented to the fact that the patient that he or she is seeing is suffering not only from tuberculosis, but from a range of mental health problems as well.
Yes.
And that these are integrated and these are interlinked, and you cannot treat one without the other.
Absolutely. Absolutely.
So this is a challenge that I think we'll all have to come together to address, and it has to be addressed at all levels.
And if I may add at this point, I mean, the traditional thinking that mental health requires a qualified psychiatrist or a psychologist, true, it is that ideally that is how it should be. But imagine a country of 140, 1.4 billion, right? India. And we simply do not have the number of super specialists to handle mental health. So unless we start figuring out ways to capacitate primary healthcare providers in mental health, right? So there is no way we will be able to even come close to meeting the supply side. So we have to start thinking of ways to capacitate our primary healthcare system providers, our nurses, our ANMs, our CHOs, our PHC doctors on mental health, so that at least they're able to do the first level of things that is required, right? Talk to the patients, identify issues if required, refer if required. So unless we work on that, there is no way we are going to meet the requirements. As you rightly said, it is a growing phenomena, and we need to make sure that the supply side also keeps up with it.
You're right, sir. It's not something that we're going to get a psychiatrist to handle
Yes.
or specialist to handle. That's not going to be the way to go. We cannot do it that way. It's impossible, impractical. And we need to, therefore, for all of the primary healthcare uh, uh, persons, who are, whether they're doctors, they're nurses, they're ANMs, whoever they are, to be oriented to this area of work, so that it's integrated within their own work, and they are themselves conscious of it and can provide the counseling that's needed.
Yes.
All these patients will need counseling, and they will need counseling from all of these healthcare providers, and the healthcare providers therefore have to be oriented, as you said, and they themselves have to be equipped to be able to address this issue. So mental health is a huge issue, and I'm glad we touched upon it. But coming back to the basic subject that we are trying to address today, since we're coming to the end of our discussion, our conversation, which has been for me very enriching, is the whole issue of navigating the intersection of water, climate, and primary healthcare. I think I'd like to hear from you some concluding remarks on what we can do and what are the priorities and how can we address them, sir.
Yeah. So, we have to start thinking to begin with at policy levels, right? We have to talk about resilience and adaptation. Start with discussing strategies for building the basic resilience into healthcare systems and communities to cope with the health impacts of both water scarcity as well as climate change. And it can't be business as usual. We'll have to explore innovative approaches, climate resilient infrastructure, disaster preparedness plan, community based health initiative using surveillance tools, using artificial intelligence to predict adverse events that might happen basis the past data that we have. Start talking about preventive and sustainable practices, preventive healthcare and sustainable practices. We start talking about the role of policy and governance and international cooperation in addressing water, climate, and health issues. Rightly, like you said, we need to start documenting the lessons as well. I'm sure the situations, the conditions that we face in India. If we have success stories and we are able to document it, it's highly likely that similar countries, other developing countries, sub-Saharan African countries, might not need to start from scratch. They can pick and choose and adapt our successes and simply implement them in their countries, right? So we need to start discussing the need for multi-sectoral collaborations. Health alone will not cut it. Health needs to start collaborating with the climate change divisions, the forests, the agriculture, uh, the whole 9 yards. Basically, we need to start generating evidence and using that evidence for policy making, right? And because it's a fairly relatively new area, so we need evidence, we need it fast, and we need to quickly make sure that the evidence translates into policy. We need to, as we started this, we need to make sure that community engagement and empowerment is not merely lip service. We need to make sure that it happens in the true spirit of the concept, right? We need to embrace innovation and technology. As I said, artificial intelligence and the use of ICT, the internet, and so we have a very internet-friendly and growing population with penetration of smartphones. So maybe we can do a lot of things using that. So I mean, as a call to action towards the end of this show, as you rightly said, I would strongly encourage our listeners to act by advocating for policies that prioritize water security, climate resilience, healthcare equity, and provide resources for further learning, volunteering opportunities, and ways to support organizations which are working at the grassroots or the intersection of water, climate, and health, and basically begin starting to make a noise around it so that things start to move at the policy level as well.
Thank you very much, sir. You have provided a whole range of issues and discussed a wide-ranging set of problems and issues and how we can address them. And this has been a very rich discussion. Thank you very much.
Thank you so much, ma'am, for having me on the show.
Thank you so much, Dr. Parija and Dr. Pachauri, for such an enlightening discussion. As you navigated the intersection of water, climate change, and primary healthcare, it is evident that an integrated approach is essential for these challenges. And to move forward, it is crucial to foster collaboration across various sectors, from health to agriculture to climate divisions. And the key takeaway is the importance of policy level initiatives focusing on resilience and adaptation and preventive healthcare and sustainable practices. But all these initiatives also need individual focus. So, with this context to the role of primary healthcare, let's advocate for generating and utilizing evidence, engaging and empowering communities, integration of innovation and technology, and making informed noise around these issues to drive significant change. On that note, I have a very exciting news for our listeners. Thanks to your love and support, Public Health Uncoded is reaching new heights. To connect with even more people, We are releasing the first book of our podcast series authored by Dr. Saroj Pachauri, Dr. Ash Pachauri, and me. This book covers all the themes we have explored, like sexual and reproductive health, child health, and the health impacts of climate change. And that's not all. We are launching 2 new podcast series. One will focus on gender issues, and the other on climate change and public health. So keep listening, share Public Health Uncoded with your friends, and stay tuned as we continue to unravel the complex issues in public health. Thank you and stay tuned.